Everybody to our quarter two Reach Out and Read of Greater New York October town hall. If you have ideas, if you have this cool event that you did or something that happened with the residents that you would like to present to all, make sure to contact us and we will love to connect with you so that you can present your wonderful event or opportunity at the site. This town hall is for you. Just a few housekeeping items before we get us started. Make sure that to be muted if you're not speaking and to have your camera on because we'll love to engage with you, and we'll have an engaged interactive Q&A session in a little bit. Could we go to the next slide? Okay, wonderful. So just a few items. So you should have received the agenda in a previous email. But just a few items. So we're going to do welcome and introduction, some program updates. We're going to talk about book distribution, training, and upcoming surveys. We're starting to plan our conference for next year. And so, of course, we would love to hear from you. So just exciting things coming our way. We're going to have a Q&A session and closing remarks by our ED. Next slide. Wonderful. So let me introduce our small but mighty team here at Reach Out and Read. And in today's call, we have our Executive Director, Emily Marchese, our Director of Literacy and Public Policy, Carrie Kurjak, our Program Assistant for Medical Engagement, Tim Linfield, our Manager for Individual Giving and Events, Brittany McCarthy, and myself, Jessie Licio, Director of Medical Engagement. Next slide. We also have our wonderful guest speaker, Claudia Risti, which I'm going to be introducing in a bit, but very exciting. She's going to talk about best practices at Bellevue for training our residents. Next slide. Okay, wonderful. So we're going to get us started with program updates. Could we go to the next slide? Wonderful. Starting with progress report, I want to start telling you guys thank you so much to all that submitted progress reports on time. We had a completion of 97%. That is huge. 97% rate. Is it enough? I will say not. I expect us for the next progress report to be at 100%. We host about 4 sessions for you guys to come in and ask questions. If you see a confusing question online or if you're going through some changes to your site, we're here to help. So we are launching our next progress report in January 2025. It launches January 15 with a deadline of March 1st. I know January seems like far away, but believe me, it's around the corner. Why completing progress reports? The data that you guys provide us for progress reports help your site to be performing at the best that it can. So with the data that we collect from you guys, we can see what languages you guys are currently needing for the book distribution. If you have training needs, if you have a preference on some of the type of books that we're sending your way. So the data that we collect not only helps us serve your site better, but it also let us know how well the Reach Out and Read program is excelling at your site and what type of support your unique site is needing at this time. So as a reminder, we need this for data just to see how well your site is performing, but also to see how other help systems we can incorporate in order for your site to be excelling at its best. So with that, just a quick reminder, progress reports launch in January 2025 with a deadline of March 1st, and our goal is 100%. Next slide. Wonderful. So when we're talking about site quality, in order for our site to know how well our site is doing, we do annual site visits. We usually do 1 or 2 site visits with you guys, either in person or virtually. This is a way for us to say hello to you guys, get to see your amazing program at the site, but also see how well the site is doing. So we have 4 core themes that we sort of like evaluate when we are at a site visit. They are medical providers, program management, books, and the literacy reach environment. Currently, we're giving a grade of sites with a color coding grading system that we utilize. Either a site is red, yellow, or green. This is changing as of next year. we're going to be able to give you an actual percentage so that you guys can see quality wise where are the areas that you guys are excelling. That could be a percentage of training, as we expect our sites for all of the providers that are coming in into the practice to be trained immediately. This could be books, how organized your site is with the books. Are you guys keeping track of the books accurately with a great book tracking system, which could be your electronic medical records or a tally sheet? Is it your literacy rich environment room? As you guys know, we want the families to be inspired by Reach Out and Read and literacy, of course, as soon as they're walking into the clinic. So is it a nice mural that we see walking into the practice, you know, TVs being off, or is it a reading corner that you guys have implemented? So all of this is important for us to see, and then we have a very nice discussion at the end of our site visits. Something that is not changing is the action plans that we're providing at the end of each site visit, just to see how the site could improve in the next couple of months, for example. Another thing that we're keeping same, and if anything, hopefully improving, is the amount of resources that we're giving the site. So we try to provide tailored resources per area, per county, and we work really hard to make sure that we get those resources. We learn a lot from you all, so whenever we go to a site and we see of a new free resource for the community, we make sure that we add it to our list and then share it at the end. But I'm going to let Tim talk a little bit more about this. Could we move to the next slide? Wonderful. So passing it on to Tim to talk a little bit about the resources that we currently have in place and share with you guys during and after the site visit.
Yeah, so in addition to, so we have various amounts of resources available on our website, such as resources from the New York City Public Schools, CDC, New York Public Library. In addition to that, we typically do provide some of the free CDC material, kind of the paper documents, milestones, and some of the board books that they do offer for free, just as samples. In addition to that, we also provide some resources that are helpful for staff, just kind of giving an overview of Reach Out and Read and some of the general tasks and requirements that we do ask throughout the process of the program. In addition to that, we do also provide a flyer, which is a nice resource to allow parents to know where their local library is. And this is an ever-evolving list, so we are always trying to improve the number of resources and the quality of resources that we can provide. So we're always looking for feedback and advice on more resources that we can provide as well.
Thank you, Tim. Could we go to the next slide? And with that, I would love to pass it to my colleague, Carrie, who's going to talk about exciting things, upcoming opportunities with books. Thank you, Carrie.
Thanks, Jessie. Great to be here with everyone today and to talk about some books. So Reach Out and Read of Greater New York is extremely excited to be able to provide as many books as possible for sites and for the Reach Out and Read program. We know what a core component those books are for the Reach Out and Read program and encouraging literacy at your well visits. And we've been able to do that through the past couple of years with bulk ordering our books from publishers. So we have an order schedule to do 2 times a year where we will be doing large orders that your sites will receive. By working with publishers to do large orders, we are often getting a highly reduced price on these books, both board books, paperback books, and we strive to make these books as exciting for the communities as possible and as relatable. And we want to make sure that the content's diverse. We want to make sure that the books are able to be used by multiple families. So that includes our initiative to really look at the need for bilingual books. And so we continue to do that this year. I have on the screen our dates for this Book Buddies program. And how this is going to continue to work and how this will work in the future is we also bring on partner organizations to increase the quantities of our orders. So when we're approaching publishers, we are approaching publishers with dollars from Reach Out and Read, as well as other organizations. And so here we have the schedule for this next fiscal year. As you can see where we currently are, we are just about to announce the next publisher that is our winning bid. And those books will then be printed and then shipped and delivered in March, April 2024. That is the process that we're in right now. So this often takes a while. As you can see, our timelines are pretty large, which means on my next slide, I have our intention around books that are coming now that we ordered months ago. So that's the exciting news. We will have books coming in November of this year from our publishers at All About Books. I have requested shipping information and tracking information when they are shipped. I know the last I heard from them, there was a slight delay because of some of the potential union strikes in the dock workers areas. So they are looking at an early November delivery date. And again, I will provide information as soon as I can when we would get that tracking information. For this order, we have 18 different titles coming. These are in English and bilingual English-Spanish. These are mostly board books with some paperback books, and we are very excited to have some touch and feel in this order as well. So exciting things out there. We know we were pretty heavy in some other paperback shipments this year, so this board book order is hopefully going to fulfill some of the need there. I will be sending out a document also that includes a little thumbnail of each of the titles and the title of the book, the language, the suggested age range, and a little summary about what the book is. And this is for you guys, for physicians, for anyone who wants to know a little bit about the books, which age range you should be distributing, is suggested to distribute that book during. And that is we're creating that based on requests from you guys. So if there's any other notes that you would have that you would like us to include in our book ordering or in a document like this, please let us know. And we can make sure that we make that happen for this order and for following orders as well. Keep going. I'll do one more slide and then I'll pause for any questions that we have on books. But to Jesse's point earlier on filling out that progress report, how influential that is and will continue to be over the types of books that we're purchasing, that's where we're able to get feedback from you guys on books. That's also where we're able to get information from you guys on the language need at sites. So we use that then to approach publishers saying, hey, Bengali is a really big language. Russian's a really big language this year. These are some more books that we want to be purchasing. So I appreciate the progress report data that we received there. In addition, we sent out in July 2024 a books survey for sites. There is just a couple additional pieces of information that is helpful for us, specifically on shipping locations, confirming your shipping locations, and confirming the storage capacity per site. We've been very lucky to have some bulk ordering and to be able to ship a lot of books out, but we want to make sure that sites are prepared to receive the quantities that we're shipping. So knowing your storage capacity is also really important. And once we know that, that's not something we know we can't send you guys more than X number of books. So that is fantastic information. I thank everyone that's already filled out that survey. If you have not, Jesse put it in the chat there. So it's probably a 5-10 minute survey. And again, the most important information there would be the storage capacity and any additional book needs and preferences that you have, or whether your site is able to receive large truck deliveries with pallets. We, again, intend to send as many books as possible as we can to sites. I know there are a number of sites that also have their own funding to be able to purchase books. And there is opportunities around joining our Book Buddies collaborative with your organization's own funding. So stay tuned for emails on that. And then also our best options for you guys is to use Scholastic or All About Books through myROR. And then Books for Schools is another solid partner with us that has books at really great prices, and they have multiple languages. So those are the three that I would suggest looking to. And please feel free to reach out if you do have any questions around purchasing books with any budgets that you have at your own site. All right, are there any questions on books? I'm seeing the link for the progress report in the chat, so appreciate that. We can get that over to you. And thank you for the excitement around the books. All right, I will pass it over back to Jessie, I think.
Thank you so much, Carrie. One thing that Carrie did not mention is that she's doing an outstanding work. We've heard your feedback in progress reports and site visits. So some of the things that we're doing different is that you guys are getting an email before the shipments goes out just to secure and ensure that you guys have the storage capacity to receive the books coming your way. And then you're getting a second email with a description of what books you're receiving and the recommended age. I think that this is just amazing, and I just want to give a big shout out to Carrie during this call. So thank you, as Carrie said, for the excitement of books. I see that you're muted.
Thanks, Jessie. Yes, and the last thing that I wanted to mention earlier that I think was on a slide, we do have a storage unit where we do store a number of books. So if your site is running low on books and you need a couple boxes to tide you over until the next large order comes, please let us know, because we do have availability to get some books to you within a couple weeks.
Thank you again, Carrie. Wonderful. So we're doing amazing with time. I love to see that. So now we're gonna go over core training, online training, supplementary training that Reach Out Need Upgrading Your offers as an additional opportunity to engage with your site, and then training and engagement for residents at the site level, which Claudia, our guest speaker, will be presenting for you all. Could we go to the next slide? Wonderful. I want to give a big shout out to my baby girl who is in the picture right now, when she was a tiny 6-month-old reading one of our recommended books from Reach Out and Read. So talking about core training, for us, it's super important that our site, our medical providers are completing the online training. The reason why is because it gives a guidance of how to give the book during the well-child visit, all of the research behind early relational health, and all of the core components of what makes us Reach Out and Read. One of the, as you guys saw before with site quality, we request for all of our sites to have 100% of training with our medical providers. If you ever need any help adding people in the system or sending the links, please reach out to us. We would love to help you with that. So again, what covers the core training? It covers research, examples. I think that one of the most important things is examples of the interaction of the medical providers giving the book during a well-child visit, and then how to do it in the examination room, as well as best practices. I do think that it's amazing to see the examples of how the book can be given to promote healthy parent-child interactions, as well as early developmental milestones tracking in line with Bright Futures guidelines. So again, it does a million things. So beyond the research, the reason and the benefits of Reach Out and Read, it also covers adverse childhood experiences, positive childhood experiences. Again, the amount of information is infinite. The training takes about 60 to 90 minutes to take. You can always save and come back to take the training at a later time if you're unable to do it all at once. And one last thing, especially for those residents that may be a little bit hesitant to complete the training, it does give up 1.5 CME credits, which a lot of our residents need. So that's another incentive that I remind sites to mention and to use in order for medical providers to complete this training. Could we go to the next slide? Wonderful. And another thing that we provide as a resource for you and your site is an additional supplementary training. This does not replace the core training. It's something that we provide in addition for you all. So what does the supplementary training encompasses? So some of the things that we see a lot for some of the sites that we give in-person training are usually for our residents, but also for a site that just hire, let's say, 3 or 4 medical providers at once that may need some boost and support of how to do Reach Out and Read at the visit. So it basically encompasses with a summary of everything that was covered in the core training. However, we do a live sort of like role play, and we give live examples, watching some videos and opening up for conversation. I think that this is very valuable as it raises morale in the site, and the residents get very excited to want to participate in our program. Another thing that it's really exciting about is that we can bring a medical champion with us. Sometimes we're able to bring our medical director, Dr. Leora McGillner. It is just so much fun. Everybody has a wonderful time with learning about the importance of reach out and read at your practice. One last thing that I would like to add about the supplementary training, we know that each site is unique, each county is unique, so we try to provide examples and community resources that apply to your site's needs, and all of this is done through the supplementary training. So another reason why, if you're interested and would like for us to go say hello and give the supplementary training, please make sure to reach out to anyone in the med team, Veronica, Tim, or myself, and we would love to visit your site and do the training for your residents or new medical providers. Next slide. Wonderful. So now I'm going to pass it on to Claudia, who's going to talk a little bit about training and engagement residents at the site level. She is the director of Children of Bellevue at Reach Out and Read in the Help Project. I will provide in detail bio of her after this call, but I do have to say just a few things of how amazing she is. So she has been dedicated and inspired leader director for Reach Out and Read program in Health Hospitals Bellevue and the Health Project since 2013. Claudia has also trained bilingual volunteers, translated important materials, ensuring families have access to the resources they need. She actively contributes to the field by serving on the National Board of Reach Out and Read, advisory boards of Leyendo Juntos and Reach Out and Read of Greater New York. She has a strong commitment of early relational health, and she has even developed a heartfelt prenatal educational program called My Reading Promise, which encourages expectant parents to bond with their babies through talking, reading, and singing. As a parent leader in the Family Network Collaborative for Nurture Connection, she advocates for the importance of nurturing relationships, helping all families experience the joy and lifelong benefits of strong connections in early childhood. And if you had the pleasure, like I did, to be at that AAP conference back in September, you probably saw Claudia and Dr. Perry class do their amazing plenary and talk about announcing the release of the new AAP policy statement on literacy, recommendation of reading aloud to your baby since birth. So with all of this, it is my absolute honor to pass it on to Claudia. Please take it away.
Thank you, Jessie. Good afternoon, everyone. Thank you for such a kind introduction. I think I'm going to hire Jessie as my PR person for sure. Always so kind. I'm happy to be here with all of you to share some of my experiences in engaging the residents and the clinicians about Reach Out and Read and providing training and ongoing support for the amazing work that they do. Can you please show the next slide? And as a context, I just want to say I've been working here for 24 years. So what the ways of training and engaging residents and the medical community has changed over time. And I must say that one of the key components have always been trying different approaches and never being afraid to try something. And if it doesn't work, then going back to the board and saying, okay, what else can we try? And all of us are very fortunate to have such an amazing team now at Reach Out and Read of Greater New York, offering extra support. That wasn't the case at some point, but we have a wonderful team that is there to support you. So if you're not able to do it yourself, please, please, please reach out to them. And make sure you use all of these resources that they have worked so hard to put together. And I'm very grateful to always collaborate with them. So here are some of the strategies that we have used at Bellevue. We are a very big site. Every year we have on board 50 plus new residents that join our group. So you can imagine, the amount of work it takes, even just to add them into the myROR list, and the work that it takes to keep that list updated, but we believe it's important. And this is the first year in which we're actually mandating the online training for all residents. We used to only do it for attendings, but we feel in order to have a high quality site that implements the program with fidelity, everyone needs to be equally trained. Now, one of the challenges that we must acknowledge for residents on their first year, they have a lot to do, a lot to learn. And that has been one of the key issues for us to figure out where within their schedule of all the activities and all the learning that they need to do, can we plug in some training and some guidance. So when we have our new residents coming in, of course, there's a general orientation where Reach Out and Read is one of the things that are being discussed. I participate as part of those orientations. So they have the initial orientation. We are very fortunate also to count with having the medical director for Reach Out and Read National. Perry Class is one of our attending doctors. So when she's able, we can schedule also a talk with Perry to be able to tell the residents from her experience, because one of the things that I cannot talk about is what it's like to be a doctor inside that exam room, because I'm not a clinician myself. I'm not a doctor. I can imagine what it must be like, but I cannot speak from experience. But she is a doctor. She knows absolutely everything that they have to cover during the visit. So we have also Dr. Perry Class talk from her experience and encouraging them to use the book as a developmental assessment tool. Now, on their second year, what we implemented this year is that we're mandating every single resident, they need to complete the training. So we give them that little break during the first year and just provide the orientation and the basics of Reach Out and Read. By the second year, they need to have completed the online training. And the way we have been successful in implementing this, and this has been just within the last couple of months, we went from having a 75% completion rate to 87%. And I was really, really happy to see that just within a couple of months. So I have been partnering with the chief residents. That has been another key to strategies, is finding champions within your site that can help you be the so that the communication comes from their peers. They're more likely to open an email or a communication if it's coming from one of them than coming from me, because they're overwhelmed with the amount of emails that they get from different areas in the hospital. So all of them have been completing the training. And I must say that we asked for their feedback, and there have been very positive feedback about the ease of completing the training online. And the main comment I always hear from the residents, I wish I had received this information sooner. And I wish I could find the way to make sure that they do it in the first year. So if any of you at your site have been able to figure out a system in which from the very beginning, the residents are completing that training online, please let me know, because I think part of the idea behind these town hall meetings is sharing what works, what doesn't work, what you have done at your particular site, so that we all learn from each other. So please feel free to share as well. I meet with the residents as well during their developmental rotation. So every single resident, every month, I have either 1 or 2 residents, and we have a one-on-one 1-hour meeting in which we discuss. I get to hear their feedback about the training. The developmental rotation gives them one whole session the week before they meet with me to complete the training if they haven't done so. And that has been also as a very important technique to make sure is finding that time, allotting a time within their busy schedule so that they do it. And during that one-on-one, we really get to talk about, you know, their practice. How does it work? What are some of the challenges they are confronting? And we get to do a lot of role modeling. That's one thing that I highlight a lot during my conversations with them, because I always said giving the book is nice, it's important, but if that book is being put in a shelf at home and not being utilized the way it's intended, then that's not enough. So we want to make sure that our residents feel comfortable with seeing how, by modeling the book for a couple of minutes with their family, can really have the parent walk away with the image, that mental image is going to mean so much more than 1,000 words. And that it can help also create that connection with the family, that relationship with the family beyond the medical components of the visit. Another initiative that we have rolled out here is highlighting a book of the month. And we highlight a book in Spanish and in English. And every month we send out an email highlighting these two books. Because as I was meeting with the residents during the developmental rotation, I realized they're not familiar with the books. So how can they model the use of a specific book if they don't know anything about it? So that was one way in which we felt that, okay, maybe we can spark their interest in looking at the books by highlighting one at a time. And we keep looking for, and in the handout about the book of the month, we provide bullet points about things that they can tell to the parent about the book and how to use it. And also we started including a link to one of the training videos that is related and connected to the age of the book that we're highlighting. Because you also have to take into account different learning styles. Some people like reading material, some people prefer a visual. So that way you combine both. Throughout the years, we have also annual events as a way of engaging the residents. One is World Read Aloud Day, in which instead of having our volunteers reading in the waiting room, we invite the medical community to come and sign up for whatever amount of time, hopefully 20 minutes, 10 minutes, whatever amount of time they have. So they're the ones sitting on those blue mats with the children and enjoying reading aloud to the children. And that I have the doctors telling me, I love it. It was my favorite. When can we do it again? So that has been very successful. During Library Day, which we do usually at the end of June or very beginning of July, we have invited all of the representatives from the public libraries. We have representatives from New York, Queens, and Brooklyn. And they're here for a few hours during the day, helping the family sign up for the library card if they don't have one. And the increase in the number of staff members, including residents, that stop by the table and are so happy to get their library card. I have a really cute picture of a doctor being very proud holding his Superman library card from the New York Public Library. And they get really excited to be able to participate in fun events like that one. And Reach Out and Read Week. There's nothing, if you look in the calendar, you're not going to find anything that says, oh, this is the official Reach Out and Read Week. We made that up, okay? That was one of the things that was said in the beginning. You have to be creative about different ways of engaging. And we said, there is a week for everything or a day for everything in the United States. We need a week for Reach Out and Read. And to highlight and applaud the amazing work that our doctors and residents do for our families. So during Reach Out and Read Week, we have different activities. So we might have a meet and greet. Anytime you have free food, you're going to get people to stop by. So we would order pizza and say, come and learn from each other and learn about the other components of the program. And the ways in which we can work with you and support the work you do with the families. We do special games and contests, like let's say I Spy, and we have an I Spy during the in the clinic, or questions specific about the books are in the cabinet. So they have to go into the cabinet if they want to participate to have a chance to win a gift card for Target. Then they need to be able to get those answers. And it's cute to see them running around, you know, trying to get the answers or see who has the right answer for whatever question it might be. And then something else is that I try to participate as much as possible during the monthly departmental meetings that they have with the attendings, because one way is, again, engaging those champions. So the attendings have direct contact with the residents. Every resident has to talk to the attending doctor for every patient they see. So we need to make sure that the attendings are aligned also with making sure that they are reminding the residents, not only do you give out your Reach Out Read book, but reminding them about the importance of the anticipatory guidance that they need to provide and the importance of modeling the book and using the book as a developmental assessment tool. Next slide, please. This is an overview of the resident training I do at the very beginning when they first come to us. I try to time it so that they start usually at the end of June, beginning of July. So somewhere in the middle of July or beginning of August, we get together with them to talk about the evidence that this is not just a feel-good program. And I think that's important to highlight. You know, this is an evidence program, evidence-based, and the importance of the new focus of early relational health. Many of them are not familiar with this term. So introducing this concept to them and seeing how they can support the families to foster that positive connection with the baby and the importance that that has for health outcomes in the later years. They all know about adverse childhood experiences. They hear it everywhere during medical school. They hear it in talks and in trainings. But then I do the opposite of talking more about hope, healthy outcomes for positive experiences, because that's where I feel is really the heart of the difference we can make. Unfortunately, I wish I had a magic wand and could prevent all of these adverse childhood experiences that impact our families. But we are not able to do that. But there is one thing that we can do, and it's really be able to support these families and help them realize the different ways in which those positive experiences for their children and for themselves help the overall development of the child and future health outcomes as well. The importance, again, of those parent-child interactions, and that books are not just a nice giveaway, but that they're a powerful tool when used correctly. We have a couple of videos that we show, and we give them examples of topics and conversation topics that they can have with family. Because I find that the residents are more likely to just use the book at the very end of the visit as a goodbye present. Here is a book for you, baby. Don't forget it's important to read to your child, and that's it. So we look at the videos and discuss what might be some of the topics that they can use throughout the visit, so that they're checking off a lot of the things that they anyway need to check off, and are making it very conversational with the families. And so it's not just a theory, but how to make it happen at home. Next slide, please. And these are some of the things that we highlight, you know, the responsive relationship, in the importance of those tiny moments and what a huge impact they have. That encouraging the families that as they're changing the diaper, it's not just about reading, it's also talking, it's singing, and how you can include that as part of your daily routines with your baby. We have a book that we started giving out at the 1-month visit. That is Twinkle Twinkle Diaper Me. Is that the name, Aura? Twinkle Twinkle Diaper Me.
Diaper You.
Diaper You. And it's a mom talking to the baby and singing to the baby as they're changing the diaper. And we love it because it's not only the action of changing the diaper, but the connection that happened as the mom is engaging the baby in such a positive and beautiful manner. Singing songs during bath time or narrating what they're cooking. Mira, mi amor, estoy cortando las cebollas and sharing the family recipe, right? I'm cutting the onions and we're adding our secret ingredient, and that baby is going to create these beautiful memories of hearing, you know, mom and dad or the siblings talking about the things that they're doing in the house and creating those beautiful memories around meal times or during errands I spy. So just very concrete and simple ideas that can make a difference. Next one. This is what I was saying about books as being a powerful tool because they can use it as a developmental assessment tool. We take pride in the books that we choose, and we're loving the selection of books that the Reach Out and Read of Greater New York team has been able to provide to all sizes. Amazing, the quality and the diversity. So thank you so much for doing all of the hard work, and with the Book Buddies program, I've been very impressed. We currently provide books in 6 different languages. And we continuously are assessing what are the languages that are represented in our families, and ask the residents themselves to engage with us in telling us what they need, right? So during those one-on-one meetings, I said, have you noticed a difference in trend in terms of the languages represented? Can we look? Right now, we have a lot of the residents asking for books in French. And it's hard finding books in French for board books. They are out there, but they're very expensive, right? So we're continuously looking for some titles that can be appropriate for our families, but still within our budget, because of course we know. And I see someone is talking about the broom tips, and yes, we love broom. And here we, to the families that we see during the prenatal program that Jesse mentioned we provide the these rhymes and songs cards that the Brooklyn Public Library put together. In the back of each card that has a rhyme, they have tips based from Broom, and we love it and always recommend it for our families as well as for the residents. And I think the idea of promoting serve and return interactions is very important and not highlighted enough in the work that we do in terms of the residents, talking with the families. And what does that mean? Because that's a term that for us, we hear it all the time, serve and return. But what does that mean in living room language for a family and being able to demonstrate that? Next. So this is just as a reminder that we use the videos from online, you know, like I pick, let's say a 2-month and a 15-month visit of the training, the online videos that are available on YouTube, just so that we review them together and have a chance to stop, pause, and then say, what do you think? Do you see yourself doing this? Because everybody also, we have to acknowledge everybody is different and they bring their own personality into it. And what can they learn from these videos that resonates with them? And I ask them to please think about at least one thing that in the next couple of days and weeks they want to implement. So also helping them manage their expectations and goals into baby steps. And I say, and if it works for you, share it with another colleague. Go and talk to your other resident. Again, using that peer interaction, I think has been very, very helpful and effective for us. Next one. And these are just some of the examples of the conversation topics that we provide for the residents to engage families in questions beyond just saying, oh, reading for your child is good. It's good for you know, language development, brain development, but asking open-ended questions that lead to a conversation in discussion with the family and some of the resources, and encouraging them, of course, to use their library and to think about ways to include books and language rich interactions with the children as part of their everyday routine. And these are some pictures from our clinic. You see the little girl there on the blue mat enjoying her book. We have volunteers here and in the waiting room throughout the day, every single day. And it's magical. And I invite you, if anyone wants to come and do a tour with me, I would love to show you around and be able to talk one-on-one about some of the other strategies that we use to implement the program in general, not only in terms of resident engagement, but anything else. So I'm always happy to partner with other sites who might want to come and we can learn from each other. And thank you for the opportunity. And if anybody has any questions, I'll be happy to answer them.
What an amazing presentation, Claudia, as always. Thank you so much. We're opening the floor for any questions. This is a nice break that we're having here, so please feel free to put the questions in the chat, unmute yourselves. We'll love to hear from you. I would like to add that I really love the interaction that like the promotion of I guess different strategies that you utilize with the residents. So it's not limited to one, but different ones. So the one-to-one interaction that you have with them and the overall training, the fact that you do games with them, making it fun. Like the day is already very stressful and long for, you know, for a medical provider. So you're making it very creative. And I can see this being implemented with like overall staff at, you know, someone's like site or clinic. So thank you so much for those wonderful suggestions, Claudia. I think this is a nice way for us to pause our recording. Actually, no, let's just move to the next slide. I believe that was the prompt for the next slide. Yes. So since we don't have any other questions, we can move on with some announcements, exciting announcements for everybody. We're starting to plan everybody our annual conference next year. The date has been secure. It will be May 22nd of 2024. It will be in person. So this is our big comeback for an in-person conference for Reach and Read of Greater New York. More details coming soon. So we just wanted to share a few important dates. So a nice timeline for you guys to keep in mind of. So we're sending an annual conference survey on November 1st. So the open period will be November 1st to December 1st. We want to collect just suggestions from you. What type of panels do you want to hear? Any specific topic that is of interest for you? So we'll have that open period for about a month. Then we're going to have, again, our nominations. They open January 6th and then they close February 7th. But if you have a medical professional, staff member that is doing outstanding work for your site and you feel for them to be recognized and represented, please send those nominations in. That we're gonna go through nomination review sometime February 7th to the end of February with the Program Advisory Council, and then we'll be announcing the award winners on March 1st, 2025. Does anybody have any questions about conference 2025? You're completely right. Big typo there. November. Just no, actually, yes. So the open period is November 2024. And then, oh, actually, yes, I can see here, May 22nd, 2025. You're completely right. Thank you for that correction. So if anybody has any questions, please let us know. We would love to connect with you. We're going to have also tabling opportunities for you to present. We might pick a couple of sites to highlight their wonderful work at our conference. So just please be on the lookout for some of our emails. Next slide. Wonderful. So this is our contact information. If you ever have any questions or any concerns that you'd like to address, we're here to help. I thank you so much for everything. I would love to pass it to Emily for closing remarks. Thank you all.
Thank you so much for spending your Friday afternoon with us. I just want to thank Claudia for spending her time presenting and echo something that she said, in that, you know, we do these town halls for you to have an opportunity to connect with one another, share ideas, share best practices, and we're always so mindful of your time. So if there's something that you would really love for us to
look into research, put on a workshop, put into the town halls in the future, please do let us know, because we want this to be beneficial and supportive to you. And we spend a lot of time as a team thinking about how we can make as little demands on your time as possible, but still provide excellent support. And so that's why we're careful not to send too many surveys, but just the right amount, so that we're hearing from you and making sure with the books that we're providing, with the site visits that we're scheduling, we're delivering what you need the most. So we really appreciate your participation today and in all of the communication measures. It's really an honor to work so closely with so many dedicated individuals. So I want to thank you all for joining us this afternoon, and thank Jessie and her team for putting on such a wonderful opportunity for us all to connect. So thank you, and have a wonderful weekend.